Good morning, everyone. Last summer, a close person to my heart, my grandfather, had a life-changing decision to take, which was going to make a huge difference between life and death. So he was facing a severe stage of heart failure, and you can imagine how hard it was to be confronted to two choices. The first choice was to not do anything, and he probably could have a couple months left. And the second choice was to do an operation that may save his life, yes, but that may create more complications that he already had. So, having previous background information about the subject from doctors and from my grandfather, I wanted to learn more about the subject and the issues related to it. So the operation that I'm talking about is the left ventricle assist device support, called LVAD, and is usually known as a substitute for heart transplant. So you and relatives may not encounter this device in your life, and I really hope so, but I think it's important to raise awareness about this relative unknown device that may save more than one life. So while psychological and physical complications may occur, LVAD was developed and designed in order to support a failing heart and to provide health benefits, physical benefits to the health of the patient. So today I'm going to first talk about what LVAD device is, how it works. Then we will move to examine what are the different physical benefits to the device, and we will end by discussing the different physical and psychological complications that may occur in the life of the patient and the caregiver. So in order to understand what the operation is, let's talk about the device and how it works. In an article called Ethical Challenges with Left Ventricle Assisted Device as a Destination Therapy, published in 2008, the surgical implanted device has for goal to support the left ventricle, which is the main pumping chamber, and to help it pump enough blood to the organs and to the rest of the body, blood that is rich in oxygen. The left ventricle assisted device has been used for three reasons. First, as a bridge for transplantation, so when a patient is waiting for a donor for a heart transplant, the LVD could be used as a support temporarily. Secondly, it can be used for, the second reason is for a bridge for recovery. So when the heart of the patient is weak after an open heart surgery. And the third reason is, which is the one applied to my grandfather, can be used as a permanent destination therapy. So when the patient is too ill and too weak to handle any surgery or any heart transplantation, LVAD could become to be the only choice and the only means of support for the person to recover, for the heart to recover its normal function. So now, Stephen Suey, clinical director of transplantation services in Popworth Hospital, described the device and lists the different elements that form the device. So we have first the pump, the internal pump that connects to the heart and placed in the chest. The second element is the drive line, a thin cable that connects the pump to the controller. The third point is the controller, which drives energy from the batteries to the pump. And the fourth part is the batteries, which work 6 to 8 hours. And that's the batteries that delivers the energy. So now that we talked about how LVT works, let's talk about the physical benefits that the patient could experience. So, U.S. Department of Human Services and Health have tested and improved the device because of its effectiveness and because of its safety in increasing the quality of life and the physical condition of the patient. So, for example, in the article, they explain how in restoring blood flow, as I said, in restoring blood flow in the body, and in decreasing the fluid accumulation in the lungs, it restores the heart's normal function in allowing him to rest. Second, as physical benefits, the patient could also re-experience activities like run or walking, as simple as that, activities that he couldn't do before the surgery. And in an article, published in the Journal of American College of Cardiology, Mancini and Colombo have described explained how, because of the small size of the device, the surgical implantation, the surgical implantation or the operation implantation require less surgical dissection, and so yes. So now that we talked about the physical benefits of the device, let's talk about how the device, the physical and complications that the patient could and the caregiver could experience. So for the patient, let's talk about the patient first. So in an article, Rizvi McGregor and Reddy published an article called Left Ventricle Assist Device in 2008, and they talk about how, because of disorder, coagulation disorder, and the failure of the device could affect the organs, the other organs like the kidneys, and could cause hypertension, and could cause hypertension, and the psychological disorder that may occur could be because after surgery, because of this fear of having to, of thinking that the device may fail and stop suddenly, the patient could easily experience stress, sleep disruption, and sleep and driving disruption. So let's talk about the caregiver now. Sometimes the caregiver experience more and is more worried about the patient, about the problems related to the device than the patient himself or herself. So because of this constant stress and tension that the caregiver may feel, physical health problems can also, the caregiver can also experience this physical health problems. So in the past few minutes, I've showed you how LVD, left ventricle assist device, has been an important, can have an important impact on the health of the patient, because it's the main device in supporting the heart, in continuing the heart and restoring its normal function. And so we saw how what LVT device is, how it works, the physical benefits the patient could have, and also the physical and psychological disorder, the physical and psychological problems that the caregiver and the patient could have. So imagine now how the device could develop, could further develop, and not only be like simple support to the heart, but replace the heart, the hearts completely. And I wanted to leave you with this question: like, if you were like at, for example, at my place, would you want your beloved ones to take the risk to do the operation, knowing that the complication will be like worse than before? That's it. Questions?
So about the batteries, you have
Yeah.
to replace the battery.
Yeah, so it works like 6 to 8 hours, and then you have an external power supply where you can charge.
Is it different from a pacemaker?
It's like, so actually my grandfather had a pacemaker, and then after a certain time, it didn't really work. So it worked in the first, but then it wasn't efficient, enough. So he needed like something
So where's the battery kept? Is it within the...
always on him, like so in the bag or on him, so it can be attached on him. So it's quite heavy. So usually it's in the bag. Where he goes, he always had to, to carry them. Yes.
It could stop like somebody from walking.
It could have like some problems, but not stop. Usually, as the batteries, there's enough charge and enough energy in the batteries, it doesn't really stop. But it make you appear like we don't. Yes.
Can the patient do everything by himself, or he needs, or she
He needs, like usually he needs. That's why I talked about a little bit about the caregiver, because it's not only a burden on the patient himself, but also on the caregiver. So the caregiver has to help him or her in certain conditions.
How is he?
Good.
Is he,
Yeah, very good.
is he adapting?
Yeah.
Good. Thank you so much.
Yeah.